as people enter into pre-diabetes, and more so at a diabetic level, when those blood sugars have been too high for too long, you're going to start feeling kind of bad. You're going to start having symptoms. And on the screen are what some of those symptoms are. If you are experiencing fatigue, you might have pre or full-blown diabetes. It makes sense. If all that sugar is stuck in your blood, it can't get to where it needs to go to energize you, you feel tired. If all that sugar is stuck in your blood and it can't get to where it needs to go, your body's not getting fueled, you're not getting energized, you feel hungry. Your brain will trick you into thinking you're hungry, even though you might have just ate a meal an hour ago. And that is a big Julie, how can I be hungry after I ate a full meal and an hour later I'm feeling like I want to eat again? Blood sugars are too high. Got to bring the sugars down to get rid of the symptoms. Excessive thirst, excessive urination are two biggies, because those kidneys are going to kind of go, hey, what can we do to help get rid of some of this sugar to bring the blood sugar level down? And the kidneys will start grabbing fluid from everywhere to create urine that will help to flush that sugar out of you. So this is why the lab wants you to submit a urine sample. We put a little dipstick in there, and if it changes to a dark color, you have a lot of sugar in your urine. The only reason people should have sugar in their urine is if their blood sugars are too high. A normally functioning body should never spill sugar into their pee. We know that at that point something is wrong. Okay, sometimes people go, Julie, what did I do to end up with this? And I had a guy not too long ago who was very angry that he had diabetes, and his wife just kept nudging him, saying, why don't you tell her what you used to do every day in terms of drinking pop? And sometimes people say, did eating too much candy when I was a kid throw me into diabetes later in life? And the answer is no. Or drinking too much soda, did that make me get diabetes? The answer is no, but each of those could be a contributing factor. If we still eat the same way older as we did as younger people, our bodies just can't keep up anymore with the demand of eating too much, eating too many carbs, just eating too much food in general, and not moving. Okay, so there are some things that kind of go along with developing pre or full-blown. Age is a big factor. As we get older, we become more susceptible to medical problems. And that kind of holds true when we look at are most of the people who are sick older or younger? Well, the younger ones are starting to catch up, but most people are older. You know, we become more susceptible to diabetes, to heart disease, to cancer, to a lot of immune problems. Age is a big factor. Weight and activity level, there's your biggest one. We have seen our nation become a nation of, there is not one state in our country whose obesity rate is less than 20%. Every one of our 50 states has obesity levels 20% and beyond. That's 1 in 5. It's getting worse. It will continue to get worse until we start to change things, and it starts with awareness. Family history and history of pregnancy diabetes also, sorry, that's my alarm saying you're almost done. Okay. It is reversible. We can take you from pre back to normal. Definitely weight loss, physical activity, eating healthy. This is what I and my nurse that I work with, we preach every day. Hopefully it hits home. Through intervention, we can reteach your body how to use that insulin in a much more efficient manner. Okay. Of all the things that can help prevent, I do believe exercise is the most important. Because I have patients that may say, okay, well, if I just exercise but don't change the way I eat, will I have good results? And I'll say, you'll have okay results, but let's combine the two. But I do believe the exercise is the most important. You can't lose weight without exercise, at least not to any kind of permanent level of weight loss. We have to exercise. Exercise reduces insulin resistance, it reduces our stress level, it reduces our pressure, our cholesterol, our blood sugar. It has so many benefits. But I just have a hard time convincing people they need to do it. So physical inactivity has really kind of been the end result or the contributing factor of us finding our nation as large as it is. And trust me, if I had a pill that I could prescribe to people that would take care of all of this, I would. However, it's not out there. There is no magic fix. There is no silver bullet. It does, bottom line, take a lot of hard work. And it's a daily thing. If somebody's exercising only once or once every couple of weeks or once a week, it's not enough. We want something done every day. So I may start a person out exercising only 5 minutes in a given day because that's the level that they're at. It might be, I haven't done anything in 40 years, Julie. You expect me to run a marathon? No. But I expect you to, doing something is better than doing nothing. And if the person's in a little bit better shape and they just want to get beyond that, 30 to 45 minutes, 5 days a week is the goal. So I have to pick an activity or allow the person to pick an exercise that they enjoy doing. I hear patients all the time, I spent $900 on this treadmill. It does everything. I hate getting on it. It's got my clothes hanging on it, towels, it's dusty. I know, I'm there. My exercise bike has a little dust on it too, but anything that can get that person up and moving is going to be beneficial. And if treadmill ain't your thing, please don't buy one. If just walking is functional for you and you can find the time to do it, then you do that. So the same exercise is not appropriate for everybody. And then when we talk about a person's weight, now I don't normally always go according to what those charts say. I don't like those charts a lot, but it is a tool that we use, those BMI charts. It kind of tells you, it compares how tall you are to how round you are. And people that carry their excess weight here are more prone to what we're talking about. So we will try to get them to exercise and eat better to lose about 5 to 7% of their body weight. So if you're 200 pounds and you lose 20 pounds, that's 10%. If you lose 10 pounds, that's really all we're asking, to start to see improvements in those levels. So it's a big goal that we set out to do, but we have to kind of break it up into several little goals to get you there. All right. We kind of been, looking at all this different research that's been around for a while. So this whole diabetes prevention program, back in 2001, lifestyle changes reduce the risk of diabetes by 58%. That's a lot, just by changing what they do every day. We didn't look at medicine, we just looked at change your lifestyle. Start walking, start eating a little less, cut your portions by a third. In the long run, 58% less diabetes. And if you know anything about diabetes or medicines and you've heard of a pill called metformin, this is a medicine that a lot of times doctors will put people on as the first medicine. We found that, sure, metformin works, but what works better? Lifestyle changes. It worked better than putting people on a pill. That's why I only will put people on pills when I know they need it. I do diet and exercise first. Okay, make sure you're ready to exercise. Think about what you want to do, find a level that at first you're comfortable with, and as time goes by, you challenge yourself. Grab somebody that can help you along. It's always easier for me to go to the gym when I know somebody's going with me. Sometimes it is harder to do by myself. And weight loss should be slow. None of this 10 pounds in 10 days stuff. It doesn't work. You're not losing true body weight. A pound or two a week is all that we recommend. All right, so we do want it to be a lifetime commitment, that each day try to pick healthy food. Each day try to be a little more active than you were the day before. And knowing that this can actually lead to preventing a disease. That's good enough in